Another video of Rullan University. In this video, I am going to show you the basic steps of ultrasounding of the stifle. I really want to emphasize, I'm going to go to a high level basic ultrasound of the stifle because this concept needs to be understood first before we go further into other areas. For example, we're going to talk about the medial meniscus, medial femorotibial joint. We're going to talk about the patellar ligaments. Then we're going to go into the lateral meniscus, all right? And then in the more advanced course, we're going to start talking about other things like the cruciates, etc. So now, let's dive in and wait no further. So when we ultrasound in the stifle, all I want you to have is a system of where to go. What I like to do is actually, I have a checklist, and then I go structure by structure to make sure I don't forget any structure. So one of my favorite ways to start is from the medial side all the way back to the lateral. So what I'm going to do is I'm going to tell my assistant to freeze it, and then we're going to describe the structures, okay? In this particular view, freeze it, freeze. In this particular view, I'm right here in the medial side of the stifle, right? And you can see the meniscus. You can see the pouch of the femorotibial, medial femorotibial joint. So this is the medial meniscus right here. We're going to label this meniscus. We're going to save it, and then we're going to freeze it again. We're going to delete. Now, I'm going to put it again, and then I'm going to explain a little bit more about what we see in the meniscus. Right here is the medial meniscus. Freeze. All I want you to do when you start ultrasounding the stifle is take a look at the meniscus. It's fibers, there's no holes in there, right? I want you to look at the cartilage. Remember, when we are doing ultrasound, the marker goes proximal. If the marker goes proximal, that means that the marker right here is proximal. So if that's the case, this is the femur. This is the tibia. So we're going to put a T over here for reference, and we're going to put an F over here for femur. So now we have the tibia, the meniscus, the femur, and the joint pouch. Now, how am I getting this view? Very simple. I want you to actually look. You can, for one time, you can look at where the meniscus. You can look at where the patellar ligament is. You can touch it, right? And after you touch the patellar ligament, you put the probe medially, and right there you reach the meniscus. Now, what else can you see in this area? You could see the collateral ligament. Look at the collateral ligament right here. So what I'm trying to do here is look at the proximal attachment of the collateral ligament. Right here is the proximal attachment of the collateral ligament. You could actually palpate this ligament. I'm going to get some lubricant, a little bit more alcohol, and my assistant is going to give me some lubrication gel, ultrasound gel. But meanwhile, I'm going to put the probe on the medial collateral ligament right there. That's the proximal attachment. Now I want to show you something. Please. Sometimes the proximal attachment of the medial collateral ligament might be a little rough. All right, and that's normal. That is okay. Now you could also have avulsions over here, and that is not normal. But what I want to show you here is a really cool technique of following the whole medial collateral ligament. You see those irregular fibers? I mean irregularities at the proximal attachment, Chris? Right here, those irregularities are actually common and normal. And we can see the fiber pattern of the medial collateral ligament. Now I'm going to do a trick. I'm going to split this image in two, and we are going to try to have as much length as possible. I'm going to tell my assistant to freeze very soon, not yet. Okay. Freeze. Update. And now I'm going to try to connect these dots right there. I'm going to try to connect them. I think that's the collateral ligament right there. Not where I want it to be 100%. Let me see. Freeze. Update. Oh, freeze. Freeze. That looks a little better. What I'm trying to do over here is I'm trying to get a nice view of the fibers over the meniscus. Now we can see over here that here I don't really have some nice fibers, right? This is hypoechoic, but this is not a nice view. But over here you can appreciate those fibers over the meniscus. Now I'm going to try to get those again better. Now I'm doing this because I want you to use this as a tutorial. And I try not to edit these videos a whole lot so you can actually see what it takes to get the image, right? So look at that beautiful image of the collateral ligament over the meniscus. Freeze. Save. Freeze. And this is the distal insertion of the collateral ligament. Freeze. Save. In the tibia. Freeze. Now we're going to follow it up. We're going to follow it up again, and right here, notice my probe movement. I'm not looking at the probe, I'm actually following the meniscus. This takes a little bit of practice, and I want you to do this. Freeze. Right there is the collateral ligament. You got a collateral ligament right here. This is not a reference image, but I wanted to show you that you can have different images. Freeze again. You can have different views, all right? Right there is a good image. Freeze. Save. That's the proximal insertion of the collateral ligament. Now we're going to go follow it down. You're going to follow it down right there. Freeze. This is over the meniscus. Save. Freeze. And now this is the distal insertion on the tibia. Freeze. Save. That was the collateral ligament, the medial collateral ligament. Freeze. So now, what structures have we done so far? We have done the collateral ligament. We have done the meniscus. We have done the medial femorotibial joint and the pouch, right? So now the next structures that I want to look at are the patellar ligament. So the patellar ligaments, there are three patellar ligaments, right? There is a medial, the middle, and the lateral. So I'm going to start with the middle patellar ligament. The dot, which is the marker, goes medial. And I want to have a reference point right here, for example. Right here is the middle patellar ligament, decreased gain. Okay, great. Increase a little bit of gain. Increase. All right, good. So now we're gonna go right here. Notice what I'm doing, okay? I'm palpating it with my hands, and then I'm putting the probe right distal to the patella, and I'm going down, and I'm putting the ligament in the center of the screen. I'm slowly going down. Freeze. Notice that here there's some areas of it, they look quote unquote irregularities, but that's not necessarily it. There is some fibers, some fat. There's some fat in that area. So some of these areas, for example, right here and right here, there is some fat in that area. So now we're going to do it again, and I'm going to follow this right here. These are not holes. Freeze. So this is the middle patellar ligament, and these are normal. Middle patellar ligament, normal. I seldom measure, okay? I don't like measuring these because they can have many different variations, but I know that some people are still measuring, so I'm gonna just show you a quick example in case you wanna measure it, okay? All right, so I'm gonna go again for the middle patellar ligament. I start right at the tibia, I start right at the patella, and then I go down, all the way. Notice that I'm not looking at my probe, I'm looking at the screen in order to keep the screen center. My dot is medially, and right here, freeze, it's moving, is the insertion in the tibia. So now we already look at it in cross section, so we're gonna go longitudinal. I'm gonna identify, I'm gonna touch it right here, right? And I'm gonna identify right there, coming out of the patella, freeze. That's the proximal attachment of the middle patellar ligament. And now I'm gonna go back. Better make sure he's putting weight on the leg, okay? Always putting weight on the leg. Okay, good. Now I follow it down. And I follow it down. Notice the fiber arrangement. Nice fiber arrangement. It needs to be like that. I'm gonna follow it all the way down, right there to the insertion. Freeze. And that's the tibial insertion. We're gonna put a T here for tibia. Good, so now, that was the middle patellar ligament. Now we have two options. We either do the lateral or we do the medial. So let's go for it. This is the medial patellar ligament. I'm gonna put the probe. Remember my base is gonna be the middle. I'm gonna slide medially, and right there is my medial patellar ligament. So we can freeze it for reference. Save. Freeze. Now I can go and look for this ligament all the way up. Notice that it's flat, okay? Increase gain. Gonna increase gain here, please. All right, so this is the ligament, and notice that it is slightly flatter than the other ligament. Ooh, I'm gonna change this. This is medial, I apologize. Medial. So we're gonna save this, and we're actually going to delete the previous one. So I'm gonna go to review, and this is not the middle, so I'm gonna delete this. Good. So now let's take another view of that. Give me some lube. I'm gonna add a little bit of lube. All right, so here it is. This is the proximal attachment. We're gonna go further up, right here to the patella. And the horse is starting to move a little bit more, so we're gonna sedate him a touch, or we're gonna do a little bit better restraint. Come towards me, buddy. Come a little bit. Perfect. Perfect. All right. Now back to base again. Excellent. We're going to come here. That's the proximal attachment of the middle of the medial patellar ligament right here. Right now I'm going to follow it all the way down, all the way down, all the way down. Now he's moving a little bit, and then right here. Perfect. That's the medial patellar ligament. Okay, now I'm going to do it in cross section. I'm going to do it one more time so you can follow. That's the middle, and I go all the way medially, and I find the medial patellar ligament right there. That in view, freeze. That in view is going to be the medial, freeze, safe, freeze, decrease gain, perfect, freeze, safe, freeze, and we can do negative image, positive image, negative image. Notice that to do the negative image, look what I'm doing. I'm switching the probe just like this. That's it, that's all I'm doing. So I'm coming right here, I'm doing negative image, positive image. The negative image will be looking for scars. The idea is to look for any scar, because in the negative image, the scar is going to be hyperechoic, all right? So we're gonna come here, down, 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 and that's the cross section of the insertion. Now, we can come here, one more time. This is the medial patellar ligament. That's the insertion in the tibia, freeze. And then I'm going to write the T for tibia. And then we're going to delete it. And then we're going to follow it. You see those fibers are nicely, very nicely arranged. Follow the fibers, follow the fibers, follow them up, follow them all the way up to the proximal fibrocartilage of the patella. Freeze. Safe, and freeze again. Freeze. So in the more advanced course, we're going to attach all the fibrocartilage of the patella, okay? I don't want you to get super stressed out about it right now. Freeze. Safe. What I want you to do right now is to be able to do the basic structures. We talk about the fibrocartilage in the more advanced courses. Sometimes we try to do so much and get so technical about certain procedures, and I just want you to know the basics, okay? Because the basics, with these basics, you're going to be able to diagnose more than 90% of the problems of the stifle. So we are in the middle, and then now we're going to go to the lateral patellar ligament. Look how flat the lateral patellar ligament is. Now, one thing that I'm going to tell you is that the lateral patellar ligament is very boring. It's super boring. So we're gonna come here and we're gonna find it. I'm gonna find it right here. Yeah, buddy, I know. Look how boring it is. You see that? Super boring. Very tiny, wimpy fibers. I'm here in longitudinal, and I'm gonna follow it all the way up to the patella. Freeze. Safe. That's the patellar ligament. And I'm gonna follow it all the way down. All the way down. All the way down to the insertion. And freeze. Safe. And freeze. And that's the cross section right here. You see how boring it is? Kind of small, flat. Small and flat. Nothing super interesting. Now if you want to make sure you're in the patellar ligament, freeze. Safe. If you want to make sure you're in this one, just touch it. So you touch it, you go from the patella to the tibia. You have the medial, which is the nice and profound and very impressive one. Then we have the middle, which is the one that can have trouble, right? If it locks, for locking patellar. And then you have the lateral, which is right here. Right? So if you have any problems, you just touch it. Honestly, I seldom see troubles in this area, just very seldom. So I'm not going to put more emphasis than what it is. As I said, there are cool structures to find. Now, can they get injured? Yes, they can get injured. It's not as common as the medial meniscus, for example, or the trochlear ridges, etc. Now I'm gonna keep going laterally, and I'm gonna show you some really cool structure over here. In this structure, I'm gonna start with a cross section, and in this cross section, I'm gonna show you, or maybe not. Increase gain. Okay, great. I'm going to show you something because I go here first. Decrease the gain a little bit, decrease gain. Freeze. Look where I am right now. Look where I am. I was doing the patellar ligaments. Now I came laterally and I came a little distally. And you can palpate that patellar ligament, come a little laterally, and then you're going to go distally and you're going to see the Nike switch. Right here, the Nike switch, right here. You see that? This is the peroneus tertius and the long digital extensor tendon, and there's actually a cool structure around here that you cannot see on this horse because it doesn't have fluid, but you can see fluid from the lateral femorotibial joint. So you can see fluid here from the lateral femorotibial joint. I'm going to give you a quick hint. This is a golden nugget. If you find fluid there's a high chance that there is pathology on the lateral femorotibial joint, okay? Right here. So that's why I come here very fast, because if I see fluid in this area, I know that I'm going to have pathology. And it's easy and it's fun to ultrasound. Right here, look at that. It's the Nike switch. Freeze. Safe. Give me some loop. So now we're going to try to find the lateral collateral ligament, and we're going to try to find the lateral meniscus. Lateral collateral ligament and the lateral meniscus. Alright, so what do I see here? I see some fluid. So I'm going to come right here. Right here, I have a lot of hair. I still have a lot of hair, unfortunately. I might have to clip some more. Alright, so right here is the lateral meniscus. Right there. So notice how it's further back than you would think. Right? So you're going to come right here and you palpate the joint. And then you're going to put your probe, start heading back, and then you're going to kind of look forward. Let me sedate him a little bit. Let me sedate him a little bit more. So you're going to stop we're going to stop for about 1 minute.